सिपाही मुझे देने का अभिमान, देता हूँ अपनी जवानी, देता हूँ अपने प्राण, कर दूं पुरजा पुरजा जिंदगी के नाम, कोई मेरी नजर से देखेगा और दिल ये खुशी से धड़केगा.
Earlier this week, 25-year-old Karthik met with an accident in Delhi. On arrival at the Fortis hospital, he was declared brain dead. The family was dealing with extreme grief, yet they listened to what the doctors had to say and rose above their tragedy. They had a tough choice and decided to donate his organs. Now, the young man, in a way, lives on in the bodies of his 4 recipients, whom he has shown hope and light in the face of despair. Today, we dedicate this special show to Karthik, his family, and hundreds of other donor families who set aside their grief to bring light to some of those lakhs of patients who are battling end-stage organ failure, waiting in the dark, hoping and praying, even though they are keenly aware of the acute organ shortage in our country. I'm going to just welcome all our special guests who are going to take us through this. But let's just start by quickly showing you what this campaign essentially is all about. Let me just welcome Bhavdeep Singh, who's CEO of Fortis, who's here with us. Dr. K.R. Balakrishnan, Director of the Cardiac Sciences and Chief Cardiothoracic Surgeon at the Fortis Malad Hospital, a person who's come up now with a new way which potentially allows organs to be kept longer before they can actually be transplanted. We have Dr. Avnish Seth, who's the Director of Fort. It's great to have you with us. Dr. Vimal Bhandari is the Director of the National Organ and Tissue Transplant Organization. It's a pleasure to have you with us, and you're going to tell us, I think, some of the successes we've been having recently. Pallavi Kumar is the Executive Director of the Mohan Foundation, which has been working in the field of organ donation since 1997. But Bhavdeep, I think it's important to start off by taking a look at the extent of the challenge. We were talking about it as waiting in the dark, and that's still, unfortunately, the case for millions of people. They are there, they're facing organ failure, they know that they can be saved, they can have a renewed lease on life if somebody would donate. But there are not that many people out there on the donor list.
Yeah, it's a real challenge for us. You know, the data points are quite significant and staggering when you look at the rest of the world and where we are in India today. Even with, and there's been a significant shift in terms of the number of donors, the number of transplants that are actually taking place, but nonetheless, less than 1% of our population today is an organ donor candidate. I think that what's happening is, I think there's a lot of education taking place. I think there's a good partnership taking place between the private sector, the public sector, the government, and private NGOs as well, who are actually leading this movement forward. The facts are that even as we sit here today, 500,000 people die every year waiting for an organ. And that's a huge, huge challenge for us. Yes. So if we think about what's happening, if you think about the disease burden in India today, and we know what's happening with cancer, we know what's happening with cardiac disease, we know with all the things that are happening. The reality is this is an area that we can make a huge difference. I don't think it's a difference that any one of us can do individually. I think it's exactly this collective platform that will help
But
us.
I think it's also important to touch on the fact that a campaign, and if you create awareness and if you say the right things and you get people to understand why it's important, a change can happen, and a change can happen very fast. I just want to turn to you. You know, if you're looking at NOTO, which is of course in a sense a centralized repository now of data, the numbers that you are actually seeing are staggering. The number of people whom you have in your registry has gone up by how much?
Basically, we started with probably 9,000 plus donation, and now it has turned up, you know, around 13 lakh. And our honorable health minister said that the target is 20 lakh this year, and we are approaching this target. You will be glad to know that
9,000 to 13 lakhs is a very, very big jump. And how much time did that happen in?
Yeah, because you know that these NGOs were scattered. So I try my best to involve all these NGOs. We're doing these activities for the last 20-25 years or so. Now we have got a cumulative data in our database system in Noto, so that we know exactly where what is the picture exactly. Now initially it was not there, sir. Now even you will be surprised to know that the 20,000 BSF people have pledges, and they are every month they are sending us around 500 plus pledges from those. They're saving the life of us also. The people are aware now. We are doing it because we got a lot of myth and misconception and other things, religions
right.
and all that, despite the fact that the people are coming in a big way to for awareness also.
Pallavi, you and other NGOs who are working in the field, I mean, this is a centralization of that data, so in a sense it helps to have that list of people. But are you also seeing a lot more people now starting to come forward, starting to realize why it is so important, how you can change people's lives?
Definitely, there has been a significant increase both in terms of sign-ups and in terms of donations. I mean, if you look at 2012, we had only about 200 donors, and last year we had close to 800 donors. So I feel we are in the right direction, both in terms of people who are pledging and for people who are actually going ahead and taking this decision.
So I just want to come to you, because you're, of course, really the pioneer in this field, and you're the person who's perhaps done more work in this entire area than anyone else whom I can think of. When it comes to the new technologies that are coming up, like what you are pioneering in, being able to keep organs for a slightly longer period of time. It's happening elsewhere. Australia, other countries have been able to do it. What sort of a difference does that happen? Because it's one thing is to have a donor and to get the organ. It then has to be got in time to the recipient. And that's a key issue.
The challenge in the organs with which we work, in the heart and the lungs, is that they are not very forgiving of what we call ischemic times. That means they have to be implanted within 4 hours or 6 hours in the case of a lung after the organ is donated. And now what we see is, at least in our state of Tamil Nadu, organs are being donated in smaller towns. So it's one thing for an organ to be donated, nothing to shift it to a center where transplant takes place. And the infrastructure, the social infrastructure in terms of flights or helicopters is not as widely prevalent. The other thing is, traditionally we've always stored these organs in cold ice. So there is a matter of suspense when it lands in your place, whether it will actually perform as well as it was when it was stopped. So we now have a system of keeping it perfused and assessing its function prior to implantation, so that it not only keeps the organs viable for a much longer period. So in principle you could transport over much longer distances, but also to verify and ensure that the organ is working well before you put it in, so that the outcomes are very much more predictable than they used to be.
From the point of view of the government and the health minister saying that we want to take it up to 20 lakhs, obviously the government can do a lot more about popularizing this and talking about it. Then all of us as the private sector can try our bit, but the government of course can spread the message far more than anybody else can. And this is the priority area?
No, we have got certain other priorities also. Apart from the pledges, we've got, our job is to build up the capacity building. Like we are imparting a training to the coordinators. We have trained around more than 1,000 coordinators, which are part and parcel, and they are the task forces. Without that, we cannot rush this program. One. Second, we are just trying our best to have a simulation courses for the doctors, for the anesthetists, for intensivists, or for the neurosurgeon also, because they are also not aware and they don't know how to maintain the donor and how to maintain these things. So we're trying our best. Apart from that, we are also trying to do a retrieval training to the surgeons, because it is a very specifically, you have to train the doctors for retrieval of the organs. So we are doing this in these kind of, we are just quite doing twice a year these kind of training. And we are also, trying to give a coordinator to each hospital in the government setup with a 20,000 per month to start this. And government is also planning to, to open this SOTO, State Organ Tissue Transplantation, to have a more coordination and networking and registry, because that is one of the most important part we have. So because government is quite, our Honorable Prime Minister is also, he said in Mann Ki Baat, is concerned about it.
Just wanted to ask you, if you look ahead, if you can look at it 6 months, 1 year, 2 years out, are you going to see the big gating issue here? The number of people who are willing to donate, is that going to be the bigger issue? Or the lack of infrastructure, the lack of people who are trained in how to get the organs in transplanting organ from one place to the other?
It's a vital question because even now, even in a state like ours, organs get wasted. I mean, on one hand, you're talking about not having enough donors. Then it's silly to have an organ which is donated and not optimally used. So the social infrastructure, unfortunately, is not kept pace with the technological advances, number one. So a lot of small towns, for instance, they don't have night landing facilities, they don't have airports, the roads are pathetic. So we are really stuck in, and this will take years to improve. And when that happens, a lot of road traffic accidents might come down. So the organ donation, it's a
and again, the organ care system could help in some
it will help. So we actually, I think we are at the cusp of some major breakthroughs where we should potentially, certainly in our heart, we are looking at a situation with solutions where we could keep the organ viable for 48 hours. Then what it does is, the holy grail of organ transplant is to have the organ functioning for 30 years, for as long as, which is not yet the case. So because to a large extent it depends upon the immunological match between the donor and recipient. But if you have now time available, you could really test and find out who is the best possible recipient for this organ and give it to him or her. And in which case it shifts the whole.
So that's technologically a potential.
And those are areas where I think the government should help.
Can I just add something here? See, the awareness levels are increasing, but the infrastructure has to match, and especially in the government settings. You imagine a hospital which has 5 ventilators. Now, if we maintain a brain dead person on a ventilator and there are 10 other people who are alive with a head injury who are waiting for a ventilator, you cannot have a situation where you will even have a single organ donation.